I'm Annika Hazlitt with Kaleidoscope Fighting Lupus. We are excited to share with you an exclusive interview with a very good friend of ours, Dr. Don Thomas, a clinical rheumatologist and author of the best-selling book, The Lupus Encyclopedia, which is widely recognized as the gold standard for lupus patients, their caregivers, and healthcare professionals. In this interview, Dr. Thomas describes the new second edition of his book, which includes important updates on how the latest research has improved our understanding of lupus and how new diagnostic tools and medications are advancing treatment options. Each chapter has been updated with contributions by lupus experts from around the world. There are brand new chapters on pediatric lupus, complementary medicine, the microbiome, healthcare disparities, and much more. So without further delay, here is Dr. Don Thomas with KFL's Director of Programs, Greg Dardis.
Well, welcome, Dr. Thomas, and thank you so much for being here to introduce us to the second edition of the Lupus Encyclopedia.
And thanks so much for having me here today, Greg.
Before we get into the second edition, you published the first edition in 2014. At that time, what made you decide to write the Lupus Encyclopedia?
So one day I was sitting in my office at work. It was a very busy day, and we're just putting our electronic health records in. And I get a phone call from the editor at Johns Hopkins Press, and she told me that she had seen me give some talks for the Lupus Foundation, and she asked me if I'd be interested in writing a book. And I was so incredibly busy, I didn't want to add anything else to my plate, but this was Johns Hopkins calling me, so I said yes, and that started everything. I never wrote anything in my life, but what I decided to do is I was very passionate about teaching patients in taking better care of themselves and living better with lupus, and so I designed the book around that. I had come up with something called the Lupus Secrets, which is a list of do's and don'ts that lupus patients should do, and when they do them, they do a lot better, and I kind of designed the book around that particular concept, but a lot more thorough. The other thing is I realized that patients had a lot of misinformation. For example, they would get a list of side effects on methotrexate when they would pick up their methotrexate, and most of the side effects had nothing to do with the methotrexate we were giving them. There's two forms. There's high dose IV methotrexate, and then there's very tiny baby doses that we use for lupus, and the vast majority of those side effects had nothing to do, would never occur in them. And so another big part of my book was to put practical, useful information about the drugs, what side effects could truly happen, what to do if you do get them, what to do around the time of surgery, what to do with certain foods or pregnancy or breastfeeding, so that they would have all that at their fingertips instead of trying to find things that were not true on the internet and such.
And that was things you couldn't find in other books at that time as well.
Yeah, there are some, of course, there are some very good books, like the Lupus book by Dr. Dan Wallace, fantastic, but it's just a little bit different in the things that he teaches in his book compared to what I wanted to teach in my book. I wanted to have a purely practical, useful book that patients could use every day.
And one of the things that people might notice as we get to the second edition now, in your first edition you had a subtitle, a comprehensive guide for patients and families. And you changed that to a comprehensive guide for patients and healthcare providers. What was your reasoning behind that change, and does that mean there's going to be more technical information in this edition?
Yeah, good question, Greg. So after the first edition came out, I was approached by quite a few rheumatologists and nurse practitioners and physicians assistants and nurses who were using my book to help them manage their lupus patients, because it was just so comprehensive as far as the drugs and the complications of lupus. And even myself, I actually kept a copy in my office. It was a lot easier for me to look up something quickly in my book than go on the internet and try to find it in Up to Date or other things that physicians use. And so it dawned on me that this book was helpful for healthcare providers. So I have added more technical information. It's much more thorough, but I did put it in language that's easy to understand for high school students. It's very important to me that all my readers be able to understand what's in there. So it is more comprehensive, but it is interesting that it can be very useful for patients, but also physicians at the same time.
In the second edition, there's also a difference in that you have other lupus experts contributing to various chapters, perhaps all chapters. Can you give us an idea about who they are and what they add to the book?
It's a common practice in medical textbooks for the editor of a huge textbook to have one expert do each chapter in the book. And that's because one person cannot know everything. I can't know everything. I have to look a lot of things up, look at a lot of research studies, and put what I know in there. But there's a lot of nuances that I would never know about. And so I thought, well, I should do this with my book too. So I approached Dr. George Shokas, who's a friend of mine and he's the chief of rheumatology at one of the Harvard universities, and I asked him if he would do or help me edit and put information in the what causes lupus chapter, which is chapter 3, and he said yes. And then he introduced me to all these lupus experts all over the world, and I was just so honored that almost all of them said yes in doing different chapters. So I have literally lupus experts from the United Kingdom, Israel, Crete, and Canada who are helping out with various chapters that they specialize. For example, Dr. Sasha Bernatsky up in Canada, she specializes in cancer and lupus, so she's doing the cancer chapter, for example. And then there's chapters, for example, on the pulmonary system. I have a lung expert who's doing that one. I have a gastroenterologist who's doing the GI chapter. And so I'm just very fortunate in making sure that this book is going to be even more accurate and more comprehensive and more up to date because of these specialists helping me out.
Speaking of being up to date, what are some examples of some new things that you may have added to the second edition, maybe just some examples compared to the first edition about lupus itself?
Yeah, this is such an exciting time for lupus research and what's going to happen in the future. Since the last book, there's been 2 additional FDA-approved drugs for lupus. We finally have FDA-approved drugs for pediatric lupus and lupus nephritis in children. I mean, that's just phenomenal. And so I'm including those new FDA-approved drugs, but giving much more practical and useful information like I talked about earlier, instead of just what they get in lab slips and what the drug companies are allowed to tell them. Other things that, and I'll refer to my list because I knew you were going to ask this question, so I wrote these down. I also asked patients in the first book to send me email messages about what they would do differently or what they would recommend I do differently in my second edition. So I actually took those to heart and incorporated them, and a common one was to include rare complications of lupus. I didn't do that in the first edition because I didn't think enough patients would have them, but you know, lupus patients get all these weird, unusual things that happen, and it's important that they know about them and what we can do about them. So it does include the rare complications as well as the common complications in this one. Other things, COVID-19 and lupus, how they interact with COVID-19. We also learned what drugs should be stopped around the time of vaccines, so I put that into the book as well. We know that a lot of our patients are using medical marijuana. Even though it's not proven to be helpful for lupus, we realize that our patients are using it, so I put some tips and talk about the pros and cons of using it. There's a lot more information about using complementary medicine, taking supplements, for example, turmeric and ginger. I have some evidence that they could help the immune system in lupus patients. Practicing mindfulness. I used to just think it was a new agey thing that new age people did, but there's research showing that it can actually help the immune system and help calm down stress in patients, and that probably can help reduce lupus flares and other problems. So that's included in the book, and I have a mindfulness expert actually helping me with that, and she's up at Johns Hopkins. So there's a lot of wonderful new things that are in this. Another one is our pediatric population. There's so few resources for parents of children with lupus, and 20% of adult lupus patients developed it while they were children. And so I put in a pediatric lupus chapter in the book as well. So I think they'll find that very helpful. And the chief of rheumatology at Children's National Hospital it helped me with that chapter, which I feel very fortunate about. Healthcare disparities has become has come into the forefront in the past few years, and is very important with lupus because it's one of the big things why some ethnicities don't do as well with lupus than others. So I also talk about that in the prognosis chapter. So there's a lot of wonderful, helpful things in the new book that I think that people will appreciate.
How has their understanding of lupus evolved or changed even in the last 10 years or so that also might encourage new things to be in the Lupus Encyclopedia?
Sure, and so I already mentioned a lot of them. There is a ton of research showing us better ways to treat our lupus patients and help them get better. Just for example, hydroxychloroquine is the most important drug. Everybody should be on it because it's the only drug proven to prolong survival in lupus patients. But we want to make sure we prevent the complications with the eyes, for example. But since the first book, a lot of research has been done showing us safer dosing. We can now check hydroxychloroquine drug levels to help us make sure patients are on the right dose and make sure they're not missing doses. And also the eye exam tests that we have today are much more sensitive, and it would be really rare for someone to develop an actual eye problem because of all of these things. So that's part of the research. And then looking at the immunology research has just exploded to where we can see all these different parts of the immune system that are abnormal in lupus patients. And if we can find therapies that just direct certain parts of the immune system to help lupus patients instead of just suppressing the entire immune system and putting them at high risk of infections like the older drugs that we use in lupus patients. So that research is just exploding, and because of that we have a ton of drugs that are in the pipeline that show incredible promise for getting more patients under control. And so it is very exciting, all these new things that are going on.
There's such an incredible amount of information there, and your enthusiasm is infectious. One of the questions I have as well is, for a book, Lupus Encyclopedia, that's 900 plus pages, do you have some suggestions for how the average patient or person might approach the book to get the most out of it?
Sure, and when you look at the book and hold it, it's very heavy and intimidating, so I agree with that. Read the preface. You know, nobody reads the preface in books, but please read my preface because I actually spell out exactly how people should use the book, and I make it very easy. So it's a very practical preface. Bottom line is, first, I recommend that patients go to the very last chapter. I have my lupus secrets, the do's and don'ts. Just take a yellow highlighter, highlight what you're not doing and what you didn't know you should do, and just put those into practice because that's going to help you get better. Just like that. The next thing is I recommend that they get copies of their rheumatologist notes on their lupus. Everyone should know, what are the complications of their lupus? What do the lab tests show? For example, in my notes, I'll say this patient has systemic lupus manifested by pleuritis and nephritis, inflammation of the kidneys and the around the lungs and heart, leukopenia, low white blood cell count, positive ANA, SSA, chromatin antibody, positive Smith, low complement levels. Learn what those things are going on with your lupus, and then for each of them, look it up in the index. Go to that part of the book and read, and you'll see what's going on with your lupus and what your doctor looks for and what could possibly happen to you. And that way, if you if you make yourself more knowledgeable about your own lupus, you'll know the right things to do to combat it. And then what I recommend that patients do is to go to each part of the lupus secrets and look up that secret in the book and learn the reasons why I recommend that patients do those things. So it's a stepwise approach that they can learn to do, and otherwise it is very intimidating. I wouldn't recommend reading it from cover to cover, but some patients do, and they do amazing.
You also developed a Lupus Encyclopedia website. First, what encouraged you to do that, and how should somebody use both to get at the information they're interested in? What can they get out of both, and how is the website different?
One thing about medical textbooks is that when a medical textbook comes out, it's automatically out of date for some of the things because of the new research that happened between the time it was written and printed. And the same thing is going to happen with the Lupus Encyclopedia. And so for medicine, we have something called uptodate.com where we can actually go on the internet. I use it every day, and it tells me as a physician what are the newest things to help my patients with. And so I approached Johns Hopkins. I said, we should have something like this for the Lupus Encyclopedia. And they don't have the resources to do it because they're a nonprofit. But I decided, okay, I'll just start my own website. And then that way I can keep things up to date for patients. When new things come out, new research comes out, I can put it on my website that patients can go to and learn about. And so when Safnello became available, Lupkynis for lupus nephritis, when Benlysta had FDA approval for lupus nephritis and to help children with lupus, I put all that information on the website, but again in very practical information instead of the limited stuff that they could find elsewhere. So I know it's a good source that patients can actually trust. And in addition, I write blog articles about very practical things to do. For example, how to eat an anti-inflammatory diet correctly, and the science, but also the science behind it. I have links to the research studies that support it. The microbiome is very important these days. In the lay literature, it calls it leaky gut syndrome. Well, guess what? We finally figured out that the microbiome plays a big role in lupus. The microbiome are the bacteria that are on our cells, in our mouth, in our intestines. The largest part of our immune system is actually the intestinal system. Most of the white blood cells of our body are in the lining of the intestines, and they interact with the bacteria. And so I put that research on the website as well, and we figured out that some foods in the diet actually help the microbiome. So I put that information on the internet. So there's a lot of exciting stuff that I'm putting on the internet. And then plus, lupus patients can put comments on there, like things that have helped them out, and so that they can give information that other lupus patients can read about that I might not mention in the article.
As you know, and you mentioned it earlier as well, there is a huge unmet need for this kind of information in languages other than English. Do you have any plans for translations of the Lupus Encyclopedia in other languages?
So when the first edition came out, I asked that it be translated into Spanish. And unfortunately, they could. The way they do that, I guess, is that they go to a huge book fair and then they try to sell it to other publishers that do translations. But nobody was willing to do a 900-page book because it would be too complicated to do a medical translation into another language. So I couldn't do it then. And I'm passionate that I would like to get this out because our Hispanic patient population, number one, they're much more likely to get lupus than, for example, our Caucasian population, and they get it more severe. So it's really important that they have this information available. Most Hispanic people around the world do not speak English and cannot read English. South America and Central America has very few resources like this to help them with their lupus, so I would like to get that out there. So we figured out that once we get done with the full second edition, I'm going to pare it down to just about 250 pages instead, to amount that a publisher is going to be willing to buy from Johns Hopkins Press and translate it into Spanish and hopefully hopefully other languages, so other people around the world can get help. And for example, I met with the lupus groups from around the world when I went to the EULAR, European Union League Against Rheumatism meetings, and I was approached by, for example, the Italian group and the French group, and they were just dying to have a translation of the book and didn't have it. So I'm hoping that we can get it out for other languages.
Yeah, that sounds great. Until then, the Lupus Encyclopedia second edition comes out soon. What is the best way for somebody to get a hold of that, a copy?
So I think you're going to have links on this that patients can easily go to, and maybe a QR code as well. But also Johns Hopkins Press, they can buy it directly from Johns Hopkins University Press. If they just Google that and Lupus Encyclopedia, they'll easily find it. And then Amazon, of course, sells it as well. The first edition, fortunately, was the best-selling patient practical usefulness book that was available, and so hopefully this one will be as well. Also, there's electronic versions that will be available, and then for people who can afford it, which unfortunately there are a lot, because a lot of our patients are young women who are teenagers or early 20s and may not be able to afford $30 for a book. It's available at most libraries that I know of. So fortunately, hopefully this will also happen with the second edition, hopefully sooner than later.
Before we end, what's something you'd like to say to the people in the lupus community now who may be listening to this?
The one statement I do have to say is that lupus patients who are watching this video right now, those are the patients who are more apt to do well with their lupus. Lupus patients who gather knowledge and educate themselves about lupus do best in the long run. And so I just appreciate your audience who's watching this now, because I know that they're going to do fantastic, and I just want to give them some optimism.
So thank you, Dr. Thomas, for making this information so accessible to the lupus community, as well as taking the time and effort to bring it up to date into many different formats as much as possible to get it to the people who really need it. Thank you very much.
And thank you so much for having me, Greg, and keep doing the wonderful job you're doing at Kaleidoscope Fighting Lupus. I'm a big fan of yours. Thank you.
We hope you enjoyed this interview with Dr. Don Thomas. For more information on the Lupus Encyclopedia and bonus online information, check out his website at lupusencyclopedia.com. To order the Lupus Encyclopedia second edition, you can go to the Johns Hopkins Press website directly or order it through Amazon. Here are QR codes that you can use to reach these websites. We also encourage you to visit our website, kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, program information, award-winning blog articles, and much more. Thank you for watching. I'm Annika Hazlitt with Kaleidoscope Fighting Lupus. And remember, you are not alone.